All right, it is 6 o'clock. We are going to go ahead and get started. We have a exciting and full agenda this evening. So I want to thank our esteemed panelists for taking time from their schedules to be with us this evening. And also would love to thank all of you who have registered and taken an interest in this session and event and learning more about future careers in the medical professions. Specifically, we're really focused on those who wish to be physicians for this event. But thank you so much for taking time. My name is Pamela Gardner. I am the director for the Delaware Health Sciences Alliance. I'm this evening's host. Just a little bit about the Delaware Health Sciences Alliance, DHSA as we're also known. The logos here on the screen represent our membership framework. We are a standalone 501c3 and nonprofit organization. And we really focus on innovative collaborations through our members as well as our strategic partners that span beyond just our membership. And we focus on multiple areas within healthcare workforce and pipeline development. So we do events like this at the high school level, engaging students. And we work all the way up through attending physicians through initiatives, including research grant opportunities, as well as workforce recruitment and development opportunities. So we're really excited to be with you this evening. A couple of housekeeping items for this evening. So we are recording tonight. So there's a lot of information that's going to be shared. We will share the link with you via email for those that registered. We will post it to the DHSA YouTube channel as well. For those who maybe were not able to attend in person this evening, but had wanted to, thank you for watching the playback. We will have moderated discussion. We're going to touch on a variety of subjects from DIMER and opportunities for high school students to get involved, recommendations for undergraduate studies, as well as the MCAT, what the life of a medical student, resident in training, and a attending physician looks like. So we have lots of experts and panelists here to share their personal journeys, as well as other advice for you. So we hope that you find this informative and engaging. We did open our registration to pre-submitted questions, and some of those questions will be answered through discussion and presentations already scheduled, and we will facilitate other questions and themes throughout the evening. Please feel free to add questions in the Q&A function of Zoom. We will look there for additional questions throughout the evening. There's no need to wait for the question section of the agenda. Go ahead and just type those in as you think of them, and we'll get to them as time is appropriate. Let's see. There are some key terms that you will hear this evening, and we just want to make sure that you have, and we level set expectations and understanding as we go through the evening. So DIMER is the Delaware Institute of Medical Education and Research. We'll learn a little bit more about that in a little bit. There are two student loan repayment programs through the state of Delaware. One is affectionately known as SLRP, and the other one is HCP LRP. So we'll learn about those later in the evening. HPSAs are health professional shortage areas, and Post-Bac is a program that allows you to ensure that you have all of those science requirements if you did not meet them when graduating undergraduate. So we'll learn a little bit more about that as well. And as I mentioned earlier this evening in my introduction, we have an incredible panel of experts with us this evening. So please take the opportunity to engage through Q&A and take in all that they have to offer. They offer so much from their own personal experience and stories and perspectives, as well as their expertise and their positions. And so we're really fortunate and so appreciative to have them with us this evening. I am just going to check and elevate a few more of our panelists. So bear with me 1 second, then we will get in a little. All right. DHSA's president and CEO, Dr. Omar Khan, should be joining us shortly. I'm going to go ahead and get started on the DIMER section of our agenda and presentation. So as I mentioned earlier, DIMER is the Delaware Institute for Medical Education and Research. It was founded in 1969, and what many of you may or may not be aware of is that Delaware is one of 4 states without a state medical school. And so Delaware's answer to that is a relationship with 2 medical schools in Philadelphia, one being Sidney Kimmel Medical College at Thomas Jefferson University, and the other being the Philadelphia College of Osteopathic Medicine. And so what DIMER is DIMER is an admissions advantage program. Through the relationship and agreements between the state of Delaware and these 2 medical education schools, DIMER reserves 30 seats, 20 at SKMC and 10 at PCOM, for highly qualified Delaware applicants to medical school. It is not a tuition reduction program. It is not a scholarship program. It is truly a admissions advantage program. What exactly does that mean, and who's eligible for DIMER? And so by being a Delaware resident, meaning that you live primarily and permanently here in Delaware, your parents and or you pay taxes as a Delaware resident, and you're registered to vote in Delaware if you're of voting age, you are automatically eligible for a DIMER. You do not have to apply to DIMER to be a DIMER applicant. That happens automatically through the application process at both SKMC and PCOM. They both have additional portions of their application that will generate an additional form for you to complete, and so that they can confirm your DIMER eligibility. And so when I say DIMER is an admissions advantage program, what does that mean? So each year, roughly over 10,000 applications are received by each Sidney Kimmel and PCOM for their first year medical slots for first incoming students. And there are roughly around 280 slots per institution. So that is a lot of applications for not a lot of seats. So the DIMER advantage takes the DIMER Delaware applicant out of that pool of over 10,000 applicants for those 280 seats, and it reduces that pool down to about the 100 applicants that we see from Delaware to these 2 schools respectively each year. And so you're now vying for a spot of maybe 1 of 20 or 1 of 10, depending on the school that you're applying to, out of 100. 80 to 100. And so that increases your admissions advantage or admissions odds incredibly. The entering class for 2021 at PCOM saw an admissions, a general admission pool acceptance rate of about, I believe it was just under 6%. However, the DIMER acceptance rate was closer to about 60%. And then the SKMC acceptance rate, again, about 5.09% for the general application pool, and the DIMER application pool, we saw about a 30.9 acceptance rate. So incredible advantages to those admissions odds. It guarantees that your application is being reviewed and considered. So we're super excited about that. In addition to the admissions advantage, DIMER also provides networking opportunities for DIMER students. We provide events and panels with medical education and healthcare leaders similar to those that are joining us this evening, DIMER leadership and board of directors, DIMER alumni physicians, peers. We offer mentoring opportunities, and we offer opportunities such as these events for you to create your own networking experience as well, and your own opportunities to create relationships with potential mentors also. We also offer the opportunity to engage in panels like this for DIMER alum, DIMER residents, DIMER medical students. We have a DIMER medical student joining us this evening to share their experience. And so there's really a wonderful way to get involved and give back. DHSA is contracted by DIMER to oversee all of its strategic outreach initiatives. And so through DHSA, we also offer DIMER students the opportunity to have writing opportunities and publication opportunities in the Delaware Journal of Public Health. We also facilitate student research work groups within the health systems and branch campuses as well. Financial aid. So it is no secret that coming out of medical school, you could be looking at more debt than you would like to think about, right? And so this could be a barrier for some as they think about applying to medical school. And we're here to encourage you to not think of that as a barrier. And we'll hear from some of our physicians later this evening in their own personal journeys, and perhaps they can each touch on as well, kind of, what does she mean? Don't think about the debt that's going to come out, right? So you're going to come out, you're going to have a really great, well-paying job. You're going to be doing something you feel called to do. And there's programs available to you to help you with that debt. So both Thomas Jefferson University, Sidney Kimmel Medical College, and the PCOM, Philadelphia College of Osteopathic Medicine, have financial aid pages on their website. And I encourage you to go ahead and go out and start looking at those, and just to get a feel. They offer information on loans, grants, scholarships. There's also the Association of American Medical Colleges, also known as the AAMC. They offer an array of resources around loan repayment programs, loan forgiveness, grants, scholarships, you name it. There's a plethora of information out there as well. As I mentioned earlier this evening, the state has 2 student loan repayment programs. The first is SLRP, and this is a federal loan payment program in partnership with the federal government that the state administers here in Delaware. And this is tied to those HPSA qualified areas. So the areas within the state that have been deemed as health professional shortage areas. So there is a restriction on where you practice within the state in order to be eligible for this program. Just this past year, the state passed new legislation that is a state-only loan repayment program, and that's Healthcare Professional Loan Repayment Program, also known as the HCP-LRP. And so this program opens up the entire state, is considered a health professional shortage area for this loan, although certain areas of the state are weighted heavier based on their need and the population served. These programs both offer up to $50,000 a year for 4 years, for a total of up to $200,000 in student loan forgiveness and loan repayment assistance. So really great, wonderful opportunities. The HCP LRP is limited at this time to residents who are just coming out of their training within the past 6 months and graduating from their residency training, who are practicing in a primary care specialty in outpatient services. So there are some restrictions within each of the programs, but there are programs available to help you with this. There are numerous high school opportunities. One of the questions that we get a lot is around, what can I do as a high school student to get involved and learn more about healthcare and or have more hands-on experience? And so these next 2 slides do not represent an all-encompassing picture of what is available. It's just a slice of the pie of what the opportunities are for you. Pre-COVID, some of these programs may have been more robust, and there were more, I think, shadowing opportunities than there are perhaps now. However, in doing some of my own research in preparation for this evening, it looks like a lot of these programs are starting to come back online, meaning they're starting to welcome folks back in person and or still offering virtual opportunities. So all of the healthcare systems that are represented here tonight offer high school opportunities to get engaged, to learn more about healthcare, different careers within healthcare, as well as the University of Delaware offers a health sciences summer camp. The summer camp is prioritized for underrepresented minorities in medicine. However, it is open to students statewide. It's an exciting and wonderful opportunity. I encourage you to check out their website. Through the state of Delaware, the Department of Education offers the HOSA program in many high schools. There are high schools that HOSA is not directly linked to, but they do offer programs for students in those schools that they're not directly embedded in. Apollo Youth in Medicine is a program primarily in Newcastle County, but I believe they have offered some virtual opportunities, so another selection. And in just a few minutes, we'll hear from my colleagues at the Delaware Academy of Medicine and the Delaware Public Health Association, who not only offer student loan repayment programs, but also programs for high school students to learn more and get more engaged in healthcare and medicine as well, known as mini-med. I am going to, let's just see, I think we have, before we go to Kate, I do see that Dr. Khan is with us, and so I'm going to stop sharing my screen, and I will ask Dr. Khan if he would like to say hello before we move on to Dr. Smith and Giselle Bermudez. Dr. Khan?
Hello, Pam. How are you? And thank you everyone for joining us this evening. Sorry, we had some technical difficulties from my end with some changes in our remote software access, so it took me a little while to get on here. But just wanted to thank everyone, especially our panelists, for being here today. And the mission of the Delaware Health Sciences Alliances really starts with having these kind of events with educational outreach for those in high school and beyond. And ultimately, this type of work really feeds our Delaware workforce and helps take good care of our communities. So happy to be here, glad to answer any questions. And I want to thank especially my colleague, Pam Gardner, for directing this program. And we hope to get lots of great engagement. And again, thank you to the panelists. Pam, back to you, unless there's any particular areas you'd like me to cover.
Great. No, thank you, Dr. Khan. Your input will certainly be valuable as we move through the evening and take questions. So thank you so much for joining us tonight. Without further ado, Dr. Smith and Giselle Bermudez, thank you so much for being with us and sharing more about the programs that you offer.
Yeah, no problem. And I do want to say, if anybody's interested in those programs that Pam put up, with the high school students and all the, all of those types of programs. If you go to the Delaware Journal of Public Health's website, djph.org, our most recent journal actually talks about the Delaware health workforce. And one of the articles in it is all about the programs that she was talking about. And it's a big environmental scan of all the programs available to as a healthcare pathway in Delaware. I don't know, maybe I can put it in like Q&A or the chat or somewhere. I don't know if I can get it. I'll give it to Pam and Pam will get it out to everybody. How's that? Pam, did you want me to run my slide or did you have it?
Oh, I'm so sorry. I will run your slides.
All right. I thought so, but you never know.
Am I? No, hold on. Bear with me.
I see your desktop.
All right.
Beautiful.
Okay, perfect.
All right. So without further ado, I'm going to give it over to my colleague, Giselle, and she can tell you all about our student financial aid program.
Good evening, everyone. My name is Giselle Bermudez. I am the newly hired Student Financial Aid Coordinator. I'm with the Delaware Academy of Medicine, Delaware Public Health Association. We provide general assistance loans to Delaware residents studying medicine, dentistry, nursing, dental assistant, medical assistant, and behavioral health. We have funds that are available, which are designated through the Academy DHSA and Delaware ARPA, which is the American Rescue Plan Act. We have loan amounts that average between $2,500 to $15,000 annually, and the amount determined would be based on available funds and the degree program the student is enrolled in. All right, so we actually now have 2 loan programs that are funded through the Academy and ARPA. So the most common one that folks may be aware of is the loan program designated for physicians and dentists. The loan for this specific area is interest-free while you're in school. You are required to be a U.S. citizen, a Delaware resident. You must also be full-time and also in an approved medical or dental program. Repayment for this specific loan typically starts 1 year after graduation and you are required to apply each year if you wish to continue to receive funding. Our deadline for this specific loan application is May 15th. Students will be receiving award notifications at the end of June. The healthcare provider loan program is actually new. We received ARPA funds through the state this year. So we have a ton of money to award students. So please spread the word. This specific loan is also interest-free. You are also required to be a US citizen and a Delaware resident. Because there are so many programs out there and the category healthcare is so broad, the Academy Delaware Public Health Association will determine if your degree program fits the criteria for ARPA funding. So just go ahead and apply for it if you feel like you meet the criteria for it. In regards to repayment for this loan, for some students, such as students enrolled in like dental assistants or medical assistants, your loan will start, will qualify to be repaid within 6 months after graduation, since your program is a little shorter compared to other degree programs. But most programs do start 1 year after graduation. We have a rolling application for the healthcare provider loan application. So we will be reviewing and accepting applications all year round. So feel free to apply, whenever you get a chance. And then if you wish to learn more about our loan program, feel free to check us out on our website, which is listed on our screen, and it's delamed.org.
Right, my turn. Just wanted to give you a brief look at what our student internship program is and does. So as Pam said, we have lots of opportunities for high school students to work with us and learn more about public health and how public health kind of relates to medicine. So we do have the lofty objective of educating the next generation of public health and health providers in Delaware. But we do like to partner with all kinds of people throughout the state, network our interns out to people who have, like-minded thoughts and wants about what type of research. So we are open to all backgrounds and interests, high school, undergraduate, and graduate students. And the way that it works is that you basically get to pick a public health topic that interests you, find a gap in it, and then create a public health program that will close that gap. I don't want to tell you more. It'll give away the surprise when we have an interview. But you are more than welcome to come to our website. If you want to scan the QR code on the screen right now, that's our website. Or you can get there by going to the website that Giselle showed you in the last screen. And we will be happy to have anybody as an intern with us.
Great. Thank you so much for sharing about your incredible programs and helping Delawareans make their dream of being involved in medicine more of a reality and providing those opportunities. So thank you so much. We will have time for questions in just a little bit. We'll pause. It's now my pleasure to introduce Dr. Saskia Richter of the Medical Scholars Program at the University of Delaware. We've gotten a lot of questions pre-submitted around recommendations for studies and recommendations for ways to get involved. So we're super excited to have Dr. Richter with us this evening, and I'll stop sharing so she can start.
Awesome. Thank you so much, Pam. I'm excited to be here. Let me switch over our PowerPoint. All right. Can I get a thumbs up? You guys can see that?
All good. Thank you.
Perfect. Thank you. Okay. So as was mentioned, my name is Dr. Saskia Richter. I am with the Center for Health Profession Studies here at the University of Delaware, and I am specifically the director for the Medical Scholars Program here on campus. But I'm going to tell you guys a little bit about everything that we offer here on campus through the Center for Health Profession Studies. So our mission as a center is to provide guidance for any University of Delaware student interested in pursuing careers within healthcare. So not just medicine, right? This is PT, OT, dentistry, optometry, any of our healthcare realms. We provide advisement, we have programming throughout the years, different opportunities, both on campus and off campus. And a really big thing is we help you with your application to those professional programs. So here is our team at the Center for Health Profession Studies. Dr. Dave Barlow is our director. As you can see, I am specifically for Med Scholars Program. Dr. Jen Nowen runs HPEC, Health Professions Evaluation Committee, that I'll tell you more about. And then we have amazing support staff with Caroline, John, and Allison. So I'm going to go through 6 of our big programs here, and these are kind of in order of how you would encounter them should you come to the University of Delaware. So we're going to start with freshman year and work our way all the way up. So for freshmen, we sponsor what's known as a living learning community. So this is a preset dorm on North Campus where when you apply for the University of Delaware and you get accepted and you're trying to figure out your housing, you can select to be part of the Health Professions Living Learning Community. This means every other freshman, first-year student that is in this dorm with you is also interested in some realm of healthcare. So you get this dedicated on-campus community, which is great because your first year is really tough when you have your intro bios and your intro chems. You're just trying to figure out what clubs should you get involved in. You have all of these people directly around you to help you with that process. We do have special programming throughout the year for those students. So you can see some examples of the flyers our graduate student had made for those. And then starting in the fall of 2023, so this upcoming fall, we'll actually have a specific UNIV 101 section. So UNIV 101 is a required course for all freshmen when they're coming in. That just kind of introduces you to life as a college student. And this one will be specifically geared towards students interested in pursuing healthcare. We also offer health professions advising. So this is available to any student on campus, as well as alumni to the University of Delaware. You can have scheduled appointments with any of our staff members, or we have drop-in appointments as well. We have 2 locations on campus now, one on main campus, 105E Pearson Hall, and then we recently opened a second location down at the Star campus or South campus within the Health Science Complex. So with advising, it's a big thing that we do through the center. I'm guessing what some of you guys submitted as a pre-question is, what major should I be if I want to go into medicine, right? And the answer is you actually can be any major you want. We want you to be excited about what you're studying for 4 years as a graduate student, but we also want to set you up for success. So making sure that you choose a major that allows you to have your prerequisite courses done in a synchronized fashion so that you're set up to take your MCAT, your different entrance exams for professional programs. So our advisors help you set up, what type of schedule do I need? When do I need to think about taking these exams? When do I need to even apply for whatever programs I'm interested in? Again, these are open to any student on campus. Any major is welcome to come by and receive advisement. All right, now specifically some programs that we run. The Medical Scholars Program, also referred to as the MSP, if you see that acronym around. This is a 4+4 early conditional acceptance program. So you do your 4 years at the University of Delaware to earn your bachelor's, and then you would do 4 years at a medical school. So we have 3 affiliated schools for this program. We have PCOM, Rowan Virtua, and Sidney Kimmel Medical College, SKMC. So the way this program works is you actually apply as a sophomore student to join the Medical Scholars major. It's the Bachelor of Arts in Liberal Studies. So you come in as a freshman, you can be whatever major you want. And then as a sophomore, you can apply to this very competitive program and then join the Bachelor of Arts in Liberal Studies major. What's unique about that major is you're not only getting the prereqs that you need for medical school and for our affiliated schools, but you're also going to get some really unique experiences. We have required practica courses. So throughout your tenure, you would take 2 classes that actually put you in the hospitals directly with shadowing, and you get to choose 1 of 4 specialization tracks. And these tracks include research, public health, nutrition. We have one on healthcare ethics. So different ways that you can kind of tailor your education there. Along with getting that special degree, the BALS, There's also programming throughout the year. So we meet as a group with the medical scholar students every single month. We bring in local clinicians to talk about different aspects of medicine and different specialties. We help you prepare for your MCAT. We help you get advanced clinical experiences. It is a really cool program. And if it's something that you're interested in your freshman year, you're welcome to come and join some of our interest meetings, learn more about it. And again, then you formally apply as a sophomore. All right, then moving down the timeline, we have the Health Professions Evaluation Committee. So this is typically going to be done the spring before you apply to whatever program you're interested in. So if you're thinking you want to do 4 years of undergrad and then go to med school, this would be done the spring of your junior year. This program is going to review applications for students interested in medicine, dentistry, optometry, or podiatry. So it's just those four. If you're interested in physical therapy or physician assistant, we have other resources for you. They just don't go through what we call HPEC. HPEC has programming to help you develop your application packets to make sure that what you're submitting to these schools is of high quality. You actually do 2 interviews with members of our panel, and those include both clinicians locally as well as faculty here at the University of Delaware. And then we do a full panel review, and you essentially get a stamp of approval from the university. And we say, we recommend you for med school, we enthusiastically recommend you, or you are our highest recommendation. So when we then apply to med school, you kind of have this letter on top of your application from the University of Delaware. Again, this is later on down the track in undergraduate, typically going to be junior or senior year, but just to have it on your radar. All right, one of the most exciting things that I like to talk about that we offer through the Center for Health Professions is we sponsor a study abroad program. So I actually just got back from Genoa, Italy on Saturday night. I took 20 undergraduate students to Italy with me for 3 weeks, and they had 75 hours of direct hospital shadowing. So we had a pediatric hospital and then a main teaching hospital in Genoa where our students were stationed. They got to watch surgeries. They got to watch babies being delivered. They got to watch neuroscans. Really cool experience for them. And this is open, again, to any pre-health major on campus. You do have to apply for the program. We said I only can take 20 students each year. We have about 50 students apply, but it's a really cool experience. You get 3 credits towards your degree as well by taking that HLTH 492, which is International Healthcare Practicum. And the location changes each year. So this year we were in Italy. Next year we're planning to be in Budapest. It's a great way to get hours shadowing directly in a hospital, but also to be able to study abroad. A lot of pre-health students feel like they can't study abroad because there are so many science classes that you have to take in your 4 years to be able to stay on track. But this study abroad, it's a micro session, it's 3 weeks in winter term, and it's actually pretty easy to fit into your curriculum. All right, and then just to kind of wrap it all up here, the Center for Health Profession Studies has a lot of affiliations. I kind of just gave you guys a big overview of everything that we have to offer, but I recommend go check out our website. And when you come to campus, if you decide to be a blue hen, go ahead and stop by either of our locations and learn more about what we can offer you. And then I'm going to not take questions right now because I know we have time for it here in a couple of minutes.
Thank you so much. This was so incredible. And you brought so much energy and passion and excitement. I want to go back to school now, so thank you. We do have some questions that were submitted that I actually pre-submitted that I'd like to address now while we have you, just because I think it's so timely. There were multiple questions submitted around AP classes that high school students are taking and how they work for the science classes and what they should be taking in high school to count for undergraduate. But I was also wondering, in addition to that, if you could maybe layer on what that means for their medical school application and the science GPAs, and if those high school AP courses, you know, what happens to those AP courses, or do they in fact have to take the course in undergraduate anyhow? Does that make sense?
Yeah, we get this question all the time. So your AP courses, if you do well on your AP exams and you get that college credit and you decide to transfer those over to the University of Delaware, they count towards your undergraduate degree, right? So say you take the AP bio exam and it counts as your first bio course at UD. Great. But then you have to take the second bio course. But then when you look at med schools, right, they're going to need X number of bio classes. So if you transfer in AP credits and it counts for all your general bios, you still have to have 8 credits of a upper level bio then towards your degree. So now you're having to take even harder classes. So not saying that you can't transfer in your AP credits and like get those credits towards your degree, but you could also want to say like play the game a little bit, right? Like if you're really good at chemistry and you did well on your chem AP exam and you come in and you transfer those, well, now you're gonna have to take upper level chem as a freshman, which maybe isn't the best choice. Or you can retake your chem, do really well in them, build that foundation, have a strong GPA freshman year, and then continue to move on through it. Again, it's whatever you decide to do, but I personally advise my students that, kind of taking that little bit easier option freshman year can be really helpful because there's so many things that you're adjusting to, right? You're living on campus maybe, or you're commuting for the first time. You're trying to figure out how to cook for yourself, or how do I like just get on the campus shuttle to make it to my 8 a.m. lecture on time? And it'd probably be easier to do Chem 104 than organic chem.
Thank you so much. I think that's such helpful information to our students with us this evening, and watching the playback will really take to heart as they're planning their classes now and thinking about classes in the future. So thank you for that. Some other questions that were pre-submitted really are a nice transition into our next panelists and their presentation this evening. And so Dr. Marshall Lee is a family medicine physician. I am sharing the wrong screen again, so I apologize. Dr. Marshall Lee is a family medicine physician with Christiana Care. She is the physician scholar for the Harrington Trust, and she is not only here to share her personal journey this evening, but also talk about the MCAT exam and MCAT exam preparation for a program that she hosts. So without further ado, Dr. Lee, thank you for being with us.
Good evening. Thank you so much for the opportunity to speak to your students today. It is always a pleasure. My name is Dr. Marshall Lee. I am a family medicine physician, researcher, and the director for the Harrington Trust at Christiana Care. And the Harrington Trust supports health equity and community health initiatives to address the social determinants of health and improve workforce diversity in Delaware. Among many of our initiatives is our Harrington MCAT Prep program, which is in collaboration with Kaplan. And the purpose of that program is support students from underrepresented backgrounds in medicine to take the MCAT exam, which is the entrance exam for medical school. As you know, there is a underrepresentation for pre-meds from historically underrepresented communities, which are African Americans, Latinos, and Native Americans. Those ethnic groups, racial and ethnic groups, comprise less than 15% of the doctors in the United States. And we know that more diverse workforce is likely to address health disparities that exist in our community. And so with the Harrington Trust, we have a number of programs in place to support the pipeline, as well as increase the diversity of physicians practicing at Christiana Care. And so I'm not sure what happened to my camera, but I am still here. And these programs, I've been inspired to create this portfolio of programs because I had a very unique journey to medicine. I grew up in the Mississippi Delta, and I always wondered why we were always at the top of every bad list and at the bottom of every good list. Health disparities, cardiovascular disease, teenage pregnancy, you name it. Mississippi was always on that list. And so I knew I wanted to go into medicine, but I knew that being the best doctor in the world would still not be enough to have a significant role in improving health disparities, and hopefully one day bringing Mississippi from the bottom of those good lists. And so that is what inspired me to not only go into medicine, but also public health. And my college, Tougaloo College, I attended, which is a HBCU, historically Black college university. They had what was called the Jackson Heart Study, which was a large cardiovascular disease study with a goal of increasing the number of health scientists from underrepresented backgrounds. And so not only did I learn how to be a great doctor through the pre-medical curriculum, but I also learned about public health and cardiovascular disease. And so that's how I learned how to merge my love and passion for medicine and public health. Thankfully, also my college, Tougaloo, had a partnership with Brown Medical School. It was an early identification program where they recruited several students our sophomore year, each year to go to medical school. And so I knew my sophomore year that I was accepted to Brown as long as I continued to maintain a high pre-medical GPA as well as satisfy the other requirements. Another benefit of that program was that I did not have to take the MCAT exam. And so there are several programs like that that exist across the United States. They are typically called early identification programs, and they have been shown to be an effective means of increasing the diversity in the physician workforce. And so one of the things that I've always tried to do since then was try to support students as they take the MCAT. Despite that exam not being in place for me, we know that the MCAT is oftentimes a barrier exam. It really does not predict how good of a doctor someone is going to practice, how well of a doctor they're going to be, but it's oftentimes a major hurdle that you have to study and pay a lot of money to prepare for. And so that's why with our programs with the Harrington Trust, we support 20 students a year with taking the Kaplan MCAT program. It is also coupled with mentoring and other supports to ensure that your pre-medical application is strong. And so that application will be released in the next few weeks. Typically, it is released in March, and our cohort runs from June to August, and most of our students take the MCAT in July. If you are interested and want to join our listserv, please email harrington@christianacare.org. harrington@christianacare.org. Since undergraduate, I successfully completed my master's in public health at Harvard. And then I completed my family medicine training at the University of Maryland. I worked for the federal government for a few years in health policy. And since then, I've been at Christiana Care for the last 4 years, leading the Harrington Trust. I also serve as a physician at our school-based health centers. Christiana Care has more than 20 school-based health centers that are located primarily in underserved communities. And I work as a doctor in an elementary school. That is the joy of my life. And I also teach residents how to be good family doctors and how to be good community health doctors and serve the needs of our community. And so if you would like to learn more about our program, please email us at harrington@christianacare.org. I look forward to answering your questions. Thank you for the opportunity to speak with you today.
Dr. Lee, thank you so much for being with us. You're such an inspiration. And I think you're doing so much, and we'll hear from other physicians in a little bit this evening who are also doing so much. And I think that's really a different perspective, right? When we think about physicians, sometimes we just think about the patient care, and there's so much more that goes into it: the teaching, the inspiring others, the ensuring that there's access. And so thank you for all that you're doing. And I'll just say that DHSA is privileged to partner with the Harrington Trust and the MCAT prep program. And I have the opportunity to meet with the cohort each year. And Dr. Lee is not joking when she says that their program is partnered with significant mentoring and, sometimes even one-on-one and group, support. All of us here tonight are talking about programs where there's an incredible amount of support that's provided. So thank you so much for all that you're doing. We will take a few questions, just a few minutes. I do want to say that the MCAT exam fee can be a barrier for students, particularly who may have financial need. And as DHSA has assessed the landscape, we've recognized partners within our membership structure, as well as our strategic partners who are providing core MCAT prep programs. And so then rather than get into that lane where our partners are already doing such amazing work, DHSA is partnering with those members and partners to take that one step further. So students, particularly those with financial need who successfully complete these MCAT prep programs of our partners are eligible for an MCAT exam scholarship fee through DHSA. We want to make sure that we are helping to remove barriers wherever they may exist, and ensuring that students have enhanced entry wherever we can certainly help support it. And that's from all of our partners. So I do want to take a pause, and we have a Dimer student with us this evening, Shefali Legray, and I hope I did not butcher how I say your name, so I'm so sorry if I did. I would love to invite you to say a few words about being a Dimer student, and you are the closest one probably to the MCAT exam on our panel. And so I would love for our students to hear from you this evening about maybe some tips of how you prepared, and we'll start there. And I'm sure Dr. Lee and Dr. Richter might be able to offer some study tips as well, because those are some of the other themes of some questions that we've gotten.
Well, hi everyone, I'm Shafali. I actually went to the University of Delaware as part of the Medical Scholars Program, and I'm currently at PCOM, and currently doing my rotations, which is kind of the practicals in third year Christiana care. So kind of being born and bred into, well, not born in Delaware, but bred Delawarean here. In terms of MCAT, I know in high school, like it's a little nerve-wracking to hear like there's this huge exam you have to take in college, and you're also taking college courses. My advice for well, I studied for the MCAT in my kind of at the beginning of my junior year of college, and then took it, I think, towards the end of junior year. It's a little nerve-wracking, but there's a lot of programs that University of Delaware offers to help students kind of prepare for that. So that's and I think they started a program also where they can like take mock MCATs and help you figure out how you fall. So I would take advantage of it. My biggest advice is in terms of MCAT studying, like try to study earlier, because it is kind of a beast, but also know your pace. Everyone goes at a different pace, so don't be intimidated by what others are telling you. I think you have to figure out what your own pace is and figure that out. But also take advantage of the advisors in the University of Delaware. A lot of them have great advice and great programs to help you pass that exam, because it can be a little intimidating, but I promise it'll be fine.
Wonderful. Thank you for sharing. Dr. Lee, do you have anything to add?
Yes, my recommendation, again, put a lot of effort into this exam. It's not one of those exams that you're like, oh, I can take it as many times as I want. Unfortunately, the medical schools get a transcript and they see all of your scores. And so my recommendation now is a large majority of students are actually taking professional courses. And so in many ways, you're doing yourself a disservice if you're not taking one of those courses, because again, the exam is not testing you on how smart you are. You can be a straight A student in your chemistry class, but the MCAT has a special way of wording the questions and tricking you. And so what those professional courses are doing is teaching you how to overcome those tricks that they put in the questions. And so I just recommend, if you can save up your summer research money or save in some capacity, holiday gifts, ask your family to contribute to it. But if you can, and somewhere or the other, I recommend that you take some sort of professional course to give yourself the best chance possible to do well.
Excellent advice. Thank you so much. Dr. Richter, do you have anything that you'd like to add?
Yeah, echoing what Dr. Lee just said, it is more about how well can you take a test than do you know the information. So test strategy is huge, especially in some of those subsections where you have to read a really long section really quickly and then answer questions about it. So I recommend to my students start studying earlier rather than later. I do recommend the professional courses as well. Dedicate that time to it. They can be expensive. Through the University of Delaware, we do have some financial aid available for some of those as well, if you qualify based on your financial aid status with the university. So if you get here and you realize that's something you really need, reach out to Center for Health Profession Studies and we can help you with getting those prep courses.
Excellent. Thank you so much. All right, we are going to talk a little bit now about, and we will come back and take some more questions. So we have talked about high school students, we've talked about Dimer, we've talked about undergraduate studies, we've talked about preparing for the MCAT and taking the MCAT, applying to medical school. So what happens after you apply to medical school, right? So you've become a medical student, and what does that look like? And after you are done with medical school, does that mean you can be a physician and go just start seeing patients on your own? The answer to that is actually no. There's residency training, and depending on your area of specialty, it determines the length of the additional training that you've received before you become an attending physician. And so we have an incredible panel lined up for this section of the evening for medical student discussions and clinical rotations for medical students in medical school, as well as residency training. And so this evening, we're going to hear first from Tanya Ray and Dr. Joyce Robert with BB Healthcare, followed by Dr. Brian Levine and his colleague Brittany Kavanaugh with Christiana Care. And we're going to round out the panel this evening and hear from Dr. Brian Alverson with Nemours Children's Health of Delaware, the pediatric hospital here in our state, sharing personal perspectives, sharing their personal journey, sharing advice, giving overviews of what clinical rotations for medical students look like and what residency training is. And so I'm going to ask each of our health systems in that order from BB to Christiana to Nemours to share a little bit about their medical branch campus opportunities for medical students, as well as residency at a high level and some personal experience sharing as well. And then we'll round out the evening with some additional Q&A. So please continue to submit your questions. We'll pause in just a little bit to answer some more. Thank you so much. So Tanya and Dr. Robert, I'm going to turn it over to you.
All right, Dr. Robert, are you on? I see you're on, but I don't know.
Yeah, I'm on.
Okay. I can't see your face. Okay, so I'll start and then I'll turn it over to Dr. Robert. So I'm Tanya Ray. I'm the Administrative Director for Graduate Medical Education at BB. We have a branch campus with the Philadelphia College of Osteopathic Medicine. So what that means is we have up to 10 third-year medical students come and do their entire third-year curriculum down at BB with us down here in Southern Delaware. They do cardio, gen surg, family med, psych, peds, a whole array of what they need for their third-year curriculum. And then we're launching our brand new family medicine residency program this July. So we're super excited about that. And I'll turn it over to Dr. Robert to talk more about the residency program.
Hey, thank you so much, Tanya. Hey, how are you? How's everybody? Thank you so much for having me. I love forums like this where we can talk about medicine, especially family medicine. I guess I can just sort of give a little bit of background about myself. I'm Joyce Robert. I'm a family physician. I am the founding program director at BB Healthcare, work with Tanya Ray. And I was born and raised in New York. I'm a New Yorker by heart. And then recently moved to Delaware, to work with Tanya and the rest of the GME team to start the program. So like many of you, to the students, who are interested in medicine, I was interested in medicine at a very young age. I had like a chronic disease. So I was always, seeing the doctor, my pediatrician. So from there, I was like, okay, she's helping me, I want to help others. So I think a lot of people, getting through the healthcare system, they have that interest of being in medicine. So that sort of sparked my interest as being a patient and seeing like how valuable physicians are. So similar to Dr. Lee, I was accepted into, I guess, an accelerated program. So this program actually recruited high school seniors. It's out in New York. It was at the time when I started, it was called the Sophie Davis School of Biomedical Education. Now it's its own medical school, CUNY Med School. It's in Harlem, New York. So when I was there, it was a bachelor's MD program where you start, first year, you do 5 years of undergrad, so you get your undergraduate degree and you do all those science courses that were mentioned, biochemistry, physiology, organic chemistry, all that. So it was a pretty much accelerated program. So we did some of like the first 2 years of medical school in our undergraduate curriculum. And then the last 2 years, you graduate with your bachelor's of science, and then you kind of complete your medical school education with partnering medical schools. At the time, it was like SUNY Albany, all of them were New York State schools, NYU, SUNY Downstate. So I got matched. And we actually kind of had like a matching system similar to residency program. So I got matched to SUNY Downstate in Brooklyn, which was, great population. Loved East Flatbush, really underserved area working with, and just learned a lot of medicine. So initially I wanted to do pediatric endocrinology. I know sounds very boring, but I wanted to do that. And then, similar to a lot of family medicine doctors, when you do your rotations, third year, you like a little bit of everything. I love seeing peds, I love women's health, I love seeing adults and geriatrics. So family medicine was pretty much a perfect specialty for me. Initially, I did want to do pediatrics, which I love seeing kids, but at the same time, I missed the other things about the family medicine specialty, even like urgent care, working in the ED, and family medicine sort of gives you the bandwidth of, dealing with people from all, ages, like what we call diaper to diaper, womb to tomb. So that was pretty exciting for me. So if you guys are interested in family medicine, definitely reach out to me. I'll try to convince you to join this amazing field where you can really meet the needs of so many patients. So after I completed medical school at SUNY Downstate, I went to residency training at Mount Sinai downtown, urban family medicine, which was down in downtown Manhattan. Again, very, underserved population, learned so many things there. And then after that, I worked in Harlem, again, underserved area. And then where we actually started a family medicine program there, and I was core faculty. So it's sort of cool, like 10 years later, starting another program and also underserved area, but a different type of underserved out down here in Lewis, Delaware. And then since then, I love academic medicine. I love teaching residents and students. I did a lot of work as, associate social medical director, where we just saw thousands and thousands of patients every month, and managing that clinic was very rewarding. A lot of hard work, but very rewarding. And then before coming here to Delaware, I worked in Long Island with another residency program where I was a transitional program director, and again, working with residents and students, did a lot of quality improvement, performance improvement, things like that, and just a whole bunch of things. So how did I end up in Lewis, Delaware from New York, New York? Tanya Ray and Dr. Hartoff and, Dr. Tam, learning that BB was creating a residency program where the need for more doctors in the area definitely, spoke to my heart, and really just be able to have the vision to create something from the ground up, even though it's a lot of work. It is fulfilling, and we're super excited to start the residency program July 1st of 2023. We'll be starting with 4 residents per year. So we're 444, and we're almost very close. We have one more day of interviews before we close out the interview season, and we're excited, to match in March and start with the residents in July. So that's a little bit about me, a little bit about our program. Tell a friend to tell a friend about BB Healthcare. We're always looking for, faculty. We're always looking for doctors to come, down to Lewis, Delaware by the beach, and tell your friends, medical students, or, as you know, we're opening up a program and we're recruiting actively all the time. Any questions, feel reach out to me if you want to know a little bit more about family medicine and such a great specialty and such a great need that we serve. Let me know. Thank you.
Thank you so much. Dr. Levine and Brittany, can we hear about Christiana Care, its branch campus and residency opportunities?
Great, thank you. It's a pleasure to be here, and you guys are getting bombarded with a lot of information, much of which is sort of foreign, and it seems like, wow, it's many years before you'll even go to medical school. So I think the key thing that I want to get apart to you guys, and we'll look at some of these slides, Brittany and I'll let Brittany introduce herself in a second, is to enjoy your life and have a life, and take your time to do things that give you passion. So if you play sports and like playing sports, that's great. If you're in clubs, I really recommend you to do as many community kinds of activities and do the best you can in high school, because the real work occurs in college. And that's where you really sort of prepare yourself for medical school. I grew up in Long Island. born in Brooklyn, just like Joyce. And then I went to medical school at the University of Vermont. And then I came down to Christiana to do my emergency medicine training. And then now I practice emergency medicine and also oversee all the residents who have been through medical school and all the medical students. So it's a lot of fun. And we all work closely together. I work with the BB folks, the DuPont folks. We're all sort of in this together to try and help you guys get to the place that will give you the passion for medicine that we all have. And we love doing what we're doing. We love to teach. But I will talk a little bit about the branch campus, but I'll let Brittany introduce herself as well.
Hi, everyone. I'm Brittany Kavanaugh. I work closely with Brian, mostly for medical students and some residency aspects as well. So happy to be here tonight and look forward to talking to you guys more.
So Brittany is sort of like my she keeps me in line. She knows exactly what needs to be done. She oversees the bulk of the 750 medical students that come through from Jefferson and PCOM. So we are just fortunate to have her. And we could talk a little bit about what life is in medical school, but we wanted to mention what happens when you're at medical school and you choose us or even BB to do a branch campus. Now, just some background on just Christiana Care. It's a pretty large facility. It's one of the biggest in the country, especially when we don't have a medical school attached to it. We're pretty much the only game in town between Philly and Baltimore of a trauma center ilk of this size of 1,300 plus beds. Christiana has over 1,000 beds itself. So it's in the top 1% in size. And an important part for us is the teaching and the training and the experience. And we'll let some of the students talk about what they think of us and BB and DuPont, but all three are really incredible experiences for the students. I mentioned having these locations, and that's really helpful from our standpoint, is that we're close to Philadelphia. So if you go to a medical school in Philadelphia, you can either commute or even live at your family's house and commute to Christiana or BB or Nemours. So we're lucky that we're location-wise, it's really very doable, as opposed to if you're like living in Long Island like I did, where the traffic is a disaster. It's much nicer to live down here in these and have access to these campuses. And just to, Christiana Care, there's, somewhere upwards of over 13,000, this is a little older slide, 13 to 15,000 caregivers. And we do have 3 main hospitals and a freestanding emergency department in Middletown. And we are a level 1 trauma center, and we won a fair amount of awards, as you can see here. And it's nice to have that recognition. And, if you look at the numbers, it's interesting. Where Delaware only has 1 million people in it, Christiana happens to be in the top 20 in the East Coast in just about every category, in the top 40 nationally. So it's nice to have that experience, to see everything coming through your door, which is pretty cool. But you're not sort of tripping over each other as students. You get a lot of individualized attention, and we limit the number of students so you each can get that attention that's needed. You can rip through a lot of this, Brittany, if you want, but just saying the high volume. I mean, we have Wilmington campus, which is in the center of Wilmington, obviously, which is a great population to take care of because the community needs us. And, you get to having that real sort of urban inner city environment, which is very cool and really important. And you can see that the hospital has an old section and a new section, which is really cool. Then you got Christiana, which is they call the mothership, which has all the transplants and the crazy stuff with research and the education and a large simulation lab, and it's just a pretty beautiful place and pretty remarkable in a suburban setting, which is cool. And then important what was mentioned before is that Delaware is one of 4 states without a medical school, and so we look towards Sidney Kimmel and PCOM to be our suppliers of medical students. That's why it's a huge advantage if you're Dimer and you heard the numbers and the ratios. I really encourage you guys to apply and check that box for Dimer in the supplemental application when you apply to medical school. That's really important. And then just a word about the branch campus, and I'll let Brittany sort of elaborate a little bit, but we're lucky that we have, upwards of 30 students a year that will spend their entire 3rd year of medical school. Now, medical school is broken up into several parts. Really, the first half or a little less than that is all sort of book learning, you're in classes, lecturing, et cetera. And then the rest of, or the final half of your medical school career is working in the hospital, which is very cool. And if you can get an opportunity to work at a hospital for the same system for the whole year, it gives a huge advantage. And Tanya can probably, or Joyce can talk about this from their standpoint, but you really meet really the same people that you're going to work with, that you really forge wonderful bonds that can help you with your application towards residency, which is to work towards the specialty that you want to go into. So we really look at branch campus as an advantage. We provide extra teaching, extra mentorship, and it really makes the experience much more palatable. My medical school had a branch campus, and I did that, and I thought it was awesome because I got to work with some great people continuously, and I wouldn't trade that for the world, and I'd recommend it if you get that opportunity. I mentioned the large number of students that we have last year, probably 770 medical students. Plus we have PA students, NP students, and then obviously thousands of nursing students and other allied health students, occupational therapy, physical therapy, radiology, speech, dietary, et cetera. We could probably rip through this. Comments, Brittany, that you wanted to mention?
No, I think you hit a lot of them. I know 3rd and 4th year rotations are very far down the line for you guys, but just know that you have several healthcare organizations in Delaware that are here to support you on your journey to becoming a physician.
And I think the best advice now we could give you is just sort of find what gives you the passion. Shadowing generally starts well, sort of towards, you know, the end of high school. We generally look towards 18 years old and up, and I didn't shadow until I was deep into college. So I don't think that's a huge, I really look for people I love, if you play a sport, great. If you're on a club and you can have a leadership role, I think that's wonderful as well. Do things you're passionate, give back to your community. We love to see people that really take initiative and show that they really want to do this. So I don't think, my parents sort of said, you should do something, this is when I got into college, that really shows that you want to go into medicine. So I got a job as an OR tech, and I learned sort of all the ins and outs of the hospital. I thought that was a great experience because it taught me about the hospital, taught me what it was like to be a medical student and to be in training. And any information I could get, I just sort of sucked that in during my high school and college years. So there are a ton of questions and we don't have a ton of time. So I think I'll probably stop right there. Thanks, Pam.
Thank you, Dr. and Brittany. Dr. Alverson, can I invite you to share some of your personal experience and also highlight opportunities with Nemours for medical students and residents?
Absolutely. So thanks everyone for having me. I'm Brian Alverson. I'm a pediatric hospitalist, which means I take care of hospitalized kids. And I've been doing that for a long time. You can see how gray my hair is. I'm old. I'm like 53. And I wanted to talk a little bit, and Pam, you're going to be mad at me, I'm sorry, but I want to talk a little about why to go into medicine a little bit in addition to Nemours stuff. Do you mind? Will you hate me, Pam, for that?
No, I love that.
Okay, cool.
You're jumping ahead to some of my questions. So that's great.
Yeah. So I think at your stage, part of the big question is like, why the heck am I doing this? I like my hunches, I want to do it. And you're way ahead of where I was. So when I was in high school, I was like, where's the cake? I had no idea what I was doing. I was like useless. But you guys are way ahead of me. You're in a program about Dimer. You're way ahead of where I was. My decision to go into medical school was very late. So I went to high school and, I did okay in school. I went to good college and it wasn't until like my junior or senior of college that I realized I sort of wanted to go to med school. And it was just through freak accident. Like I was doing research in a lab that was like doing research on monkey brains. I'm not making that up, monkey brains. And I was talking to the guy in charge of the lab and he's like, well, what do you want to do? I was like, I don't know, be a neuroscientist. I didn't know what I wanted to do. I was just trying to make him happy because that's what he did. And he was like, well, if you want to be a neuroscientist, you go to med school because the MD is good for getting grants. He said something, I don't even remember what it was. So I shadowed a doctor and I was shadowing this doctor and it was a neurologist and he wasn't a very exciting doctor to shadow. Like he wasn't really explaining things and I was sort of confused. And I was like wearing this weird white coat he gave me to wear and I didn't know what I was doing. But then I ran into this other doctor in the cafeteria, and he's like, "Oh, dude, come hang out with me. You'll have fun." And he seemed like a really cool guy. So I went and hung out with him, and I just had this transformative experience. I was walking around, I was seeing, he was a pediatric allergist, and we were seeing all these kids with these crazy diseases who, like, you know, have horrible immune problems. And it was just so interesting. And I was sort of blown away sort of by how desperate the families were and how he just instilled in them this calm, and then found ways to make their kids have sort of substantive lives. And what was inspiring to me was, like, you know, when you see a sick child, you'd be like, this is so sad. But he was like high-fiving him and fist bumping him, talk about football or whatever they were into. And it was just really inspiring. So I said, geez, I got to look at this. So I applied to medical school, and I was kind of bad. I was kind of making up reasons I wanted to be a doctor during my interview, because I thought I wanted to be a doctor, wasn't really sure. And then in med school, I had a sort of transformative experience. I was in the emergency room, and I saw a patient come in. It was a child, and this child was turning into bone. Like, every muscle in this child's body was slowly over the years becoming bone. And the prognosis for this child was awful. He was eventually going to end up frozen. And I was like so blown away by this condition that, and it's super rare disease. You've never heard of it. It's okay. And I went and researched in the lab. I said, I'm going to work in the lab and try and help this doctor who was researching it, try and figure out what the cause is. And they eventually did. And actually, like right now, they're studying a new medication to try and treat this condition. But this is 30 years later, so it's been a while. But what was so inspiring about it was this doctor who's working in this lab. He's trying to find a solution to these kids. He was really in it for the kids. And I was like, that's so incredibly inspiring. But I wasn't really a researchy kind of guy. Like, I found sitting in a lab and pipetting wasn't my jam. So I was like trying to figure out what I wanted to do, because I'm not from a family of doctors. I didn't know what I wanted to do. And I kind of liked pediatrics, and I went into pediatrics. So I trained in pediatrics. And then like at the end of my pediatrics training, I was like, well, what do I do in pediatrics? And I had sort of imagined, and maybe you guys imagine this, that my career would be, when I'm done with my training, I get a job in an office and I sit there, and then I retire when I'm 65. And that was sort of in my mind. I was going to have this sort of static period across my entire career. And it's been anything but that. And the reason why I think medicine is so cool is because that's not what it is. Because you can do anything, and you can do a million things. And I want to give you some examples of things I've done. And it's not that I'm great. The point is to show you all the different kinds of things you can do, even within my career. And yeah, I know I'm old, I'm 53, but I've got like 15 years left. I don't know what I'm going to do, but it's going to be awesome. But like, let me just give you a couple examples. So the first is, I was taking care of hospitalized kids, and a baby came in. It was a 3-week-old baby whose mother was from Guatemala, didn't speak any English. It was an immigrant. She was an undocumented immigrant, and she wanted to immigrate to the United States. And there's a law, one of the 8 million offensive laws in the United States, that was that if your HIV status is positive, you may not immigrate to the United States. It's true. And unless you're a refugee from a war-torn area or something, refugees can be, but random immigrants cannot be HIV positive. And so she didn't get HIV tested because she knew this, and she wanted to immigrate. And she had her baby in the US, so her baby's now an American citizen. She is not, she's undocumented. And it turns out she had HIV, she didn't know it. And because she didn't get tested, the baby got HIV. And the baby had this horrible fungal disease that was attacking his brain, and he was going to die. And I was very upset about this. And we actually saved him in the end, so it all worked out. There's a happy ending. But he was very, very sick. And what made me upset is the fact that if you know a baby has HIV before they're born, you can actually prevent them from getting it. And even after they're born, if you treat the baby within like 6 hours, you can prevent them from getting it. But if you don't prevent them, it's a 1 in 4 chance this baby got it. And I said, this isn't right. Why aren't we testing the mothers? If we tested the mothers and we know she had a special reason not to be tested, but maybe we could come up with some way to do this so that we don't like reveal it or something. Like there ought to be a way to do this. And at that point I was in Rhode Island. I was doing pediatrics at Brown. I right down at that point, they were testing only 52% of pregnant women. And now the random doctor can be like, okay, I treat the baby for the brain fungus and I treat the baby for the HIV and they get better and then I've done my job. But my question was, how can we fix the system? So I met with another doctor and we formed a coalition and we went to the State House and we got all these organizations to back us, like the NAACP and a bunch of professional organizations, all these groups, the AIDS organizations. And we lobbied for a new bill. And it was a real adventure. The Congress people didn't know what they were doing. I didn't know what I was making it up as I went along. The Congress people didn't know what they were doing. They didn't know how to write the bill. So I had to get my college roommate, who at that point, and I'm not making this up, was Paris Hilton's lawyer. And I said, James, you're going to hell. Anyway, you might as well write the HIV bill. So he wrote it and we got it passed within a year. Since then, there have been 0 cases of pediatric HIV in the state of Rhode Island. Now, that's not something that is routine, but it's something you can do as a doctor to make an immense contribution to the healthcare of a huge population and really make a big difference. Other things. There was a baby who came in to see me and we had to do a spinal tap because the baby had brain infection. The baby was very fussy and very hard to hold still. I was like, it's really hard to get the spinal tap when the baby's wiggling around. And I thought, and I said, wow, if I had like a device to hold the baby super still, maybe we could do something. So I met with a friend who was in like design and he was like, yeah, let's design a special chair to hold a baby so you can do a spinal tap. And we spent 4 years building this device, thinking about it. And then I found this company that could like start it and get it started. And I had to do these weird Shark Tank things where you went and like pitched it to multimillionaires. And now the device literally last month went up for sale. And I don't think this is going to be like, I'm not going to make $1 million off this thing. It's a freaking chair. But what I am going to do is prevent babies from getting lots and lots of needle sticks. And we can just do it in one quick tap. And it is so much easier. And the device just went up for sale. And that's super exciting, right? So like I made a difference in that way. And now I'm teaching. And I love teaching. I always did. I taught high school before I went to residency. And so I'm at Nemours Children's. They just hired me. I started here 4 months ago and I'm having a freaking blast. And I'm in charge of education at the Children's Hospital. And we're changing how residents are learning. And we're doing all these dynamic changes. It's going to be freaking great. And already we've made so many good, like the residents didn't like the cardiology rotation because they weren't getting to really interact with the patients as much. Children with congenital, like abnormal hearts at birth are really complicated and hard to take care of. And we've redesigned the whole thing and now they're having a blast. So we've done some fixes to the program and it's really amazing and it's really fun. And I rest easy at night, even though my job is hard. I rest easy at night because I'm like, you know what? I'm making a bit of a difference in the world. And there's something inspirational about that. There's something that's novel about that and unique about that as a field and it doesn't matter whether you're doing advocacy for underserved patients on a large scale, like my HIV project, or you're just doing it one at a time, like my kid today. She had horrible, horrible neck pain because she has a skeletal muscular condition. And I was able to make a little bit of an intervention to make her life a little bit better, but that feels good. And you're helping and you're contributing. So Nemours, I'll just say, is a wonderful children's hospital. I'm incredibly happy to be here. I'm honored to be there. And they're taking care of these incredibly sick kids, incredibly complicated kids, incredibly amazing, resilient children who I learn from every day. And this is a career that you can easily have. It's hard in the beginning. I think that as a high school student, you're like, I want to do it, but I don't know what to do. And you're just nervous. Don't worry about it. You'll be fine. I know that's easy to say. Just get into college. Just get into college. Do activities that make you look cool so you get into college. And get good grades. And then in college, like my colleague Brian said, that's when you sort of have to turn it on. and get good grades and get into a good medical school or any medical school. It's great. You'll be fine. And then what you'll notice is over time, over your career, you spend less and less time worrying about the future and more time, and this is appropriate, thinking about how can you have fun now? And I think that's your goal. I mean, the reality is, the framers of the Declaration of Independence stated it very well. There's something about the pursuit of happiness that has to be a huge part of your life. I have found, and I think many of the other people here have found, that medicine is a place where you can pursue happiness, and it is a place where you can feel incredibly rewarded for the work you do. And it's not easy, but it's just awesome. So that's all I wanted to say. Pam, I hope that was okay for you. It's been wonderful to talk to you guys. Dimer rocks. Bring it.
Thank you so much, Dr. Alverson. Always happy to have you join us. And we love your passion, and welcome to Delaware. We're excited to have you here. I would love to move into our final Q&A section of the evening. We had some pre-submitted questions. I know there's a question that Dr. Khan would like to answer live that was submitted into the Q&A function. So I'm going to ask Dr. Khan if he'd like to start with that. Encourage folks to submit any last minute questions that you may have. I have a few that we can wrap the evening up with. But this has just been an incredible evening. So engaging, so informative. We are recording it. So if you're attending this live tonight, there's a lot that was presented here tonight. And so you'll have the opportunity to go back and watch it again. Dr. Khan, would you like to go ahead and kick us off with this final Q&A session?
Sure. Thanks so much, Pam. So I think one of the questions was around what kind of advising is available to high school students in Delaware. And so typically your college guidance counselor will be the first place to start. And I think everyone said it pretty well. There's a lot of steps here, a lot of information we threw at you today. But the most important part, as Dr. Alverson just said, is to enjoy each part of the journey and think about the next step, and the one after that. But really try to enjoy each part of it. So the next step, if you're in high school, is really getting into college and finding your fit in terms of where you go to school. Frankly, it doesn't very much matter where you go to college, but it matters how you do there and how you start living your life well and enjoying yourself and participating in these activities. There's no real recipe for getting into medical school. I think, as Dr. Richter has emphasized, there's many ways to achieve that objective. But you're going to achieve it better if you're happy doing what you do. And, as you can see, Dr. Alverson, has such low energy. Brian, I don't know how you do it. It's wonderful to hear your perspective on this. And the pursuit of happiness is truly important. Keep in mind that the Declaration of Independence was drafted very close to here. And so we welcome that perspective on this as well. So pursue happiness, talk to your advisors, and you can reach out to us directly. Dr. Kate Smith spoke about some of the programs of the Delaware Academy of Medicine and the Delaware Public Health Association. We run many programs for students through that organization, and you can feel free to reach out to Kate. You can reach out to Pam, you can reach out to myself, and we'll try to direct your questions to the best resource. But if you're in high school, start with your guidance counselor and reach out to us for more information if you'd like. And somebody has asked for Dr. Alverson's email as well. And what we'll do is the recording of this will be made available to all the attendees, and we'll give you central contact information through which you can reach everybody. We typically don't share every panelist's email with everybody to put it out there. And that's to prevent folks from just getting besieged with questions that we might be able to better triage to the right person. But I know that Dr. Alverson will be pleased to speak with colleagues who are interested in pediatrics or nemours, or as Brian and I saw each other, I think 2 days ago out on the hiking trail, Brian, by the Brandywine River, about living and playing in Wilmington, Delaware, right in our city here. So glad to talk with any of you about those topics. Pam, I'd want to just mention a little bit about the dimer advantage, which I know you covered, but just want to reemphasize that the dimer program really offers Delawareans a very unique opportunity to gain admission to your state medical school program, which basically is all the partners who have got together to create this admissions program to Sidney Kimmel Medical College, as well as the Philadelphia College of Osteopathic Medicine. And both of those have branch campuses right here in Delaware. So whether you're at Christiana Care or Nemours, you can participate in the branch campus program. You can spend the second 2 years of medical school right here in Delaware, perhaps living at home if you'd like, and save some money on housing. But that is a wonderful program. The numbers are in your favor as Delawareans to apply for those programs. So we very much encourage you to think about that and talk to our experts in terms of how we can help you. Pam, do we have any other particular questions outstanding that you'd like me to address, or should we close out with a couple of comments?
Well, I just think one question just to clarify is that you are a DIMER applicant by your Delaware address, right? And so by being a permanent resident, there's not an additional program that you need to apply to be considered DIMER before applying to PCOM or SKMC. So your address, your Delaware address, and being registered to vote here and paying taxes here and or being claimed by your parents who do that here is what makes you DIMER. So I just want to kind of just echo your sentiments on the DIMER advantage from that perspective. But I think wrapping up with some closing comments and final comments would be amazing. This was such an incredible evening, and I'm so grateful for everyone that took time tonight, our panelists and attendees. So Dr. Khan, back to you.
Sure. Thanks so much. Again, thank you to the panelists. Thank you to the attendees. You have a huge advantage in being here in Delaware. Frankly, because only in states like this can you have one-on-one conversations with this fine group of people who are right here. These are the guys who, who help get you into med school, who help make the decisions around admissions for medical school, for residencies, and ultimately allowing you to come back to Delaware to practice and serve our communities, which is just such a wonderful privilege. I'm trained as a physician as well in family medicine, and I continue to see patients, and I very much enjoy that and everything that our state has to offer. So please consider the practice of medicine. Consider whatever in health sciences you'd like to do to serve our communities. We will try to make it as easy and fun for you as possible, and for you to enjoy the journey and for you to come back here. So with that, I want to again thank our panelists. And Pam, thank you again for directing a wonderful program. Always a pleasure, and hope to see you all again soon.
Thank you, everyone. Good night.
Take care. Bye-bye.